cancer and high-risk muscle invasive urothelial carcinoma after surgery, there has been no data to support an overall survival benefit. No randomized clinical trial has as of yet shown an overall survival benefit. There's been 2 trials now showing a disease-free survival, one with nivolumab, which is what we worked on, and one with pembrolizumab, which was just presented, of course, at this meeting. And so what we wanted to do is to see if we can model an overall survival benefit or a cure using the CheckMate 274 data. Mixture cure models are a way to model long-term cures or survival in therapies like immunotherapy, where you have sort of long tails on the curve. They can do this better than sort of time to event analyses like Kaplan-Meier curves, where you assume that eventually everybody will have an event of interest. In mixture cure models, that doesn't have to happen. People can have cures. And so you have a population that's cured, and that's taken from sort of baseline populations like the World Health Organizations. You have the uncured groups, and that comes directly from the trial data, from the disease-free survival, and then using the modeling, you put those together and basically develop curves that try to, as best as possible, follow the actual trial DFS curves, but also extend this over time, over 10 years. Yeah, so what we found is that both in the intent to treat population, so all patients, and in the PD-L1 positive population, there was a sort of an absolute benefit to adjuvant nivolumab in terms of cure. It was around 6 to 9% in the intent to treat population, and it was over 20%, around 25% for actually the PD-L1 positive population. So that's really a meaningful clinical difference, and it's something that you can talk to patients about and use as another piece of information when making the decision of whether or not to give adjuvant immunotherapy, particularly adjuvant nivolumab. Yeah, and so the ITT population is everybody, PD-L1 positive and negative, and then the PD-L1 positive group really confirmed the results, confirmed this long-term potential for a cure, but at a much greater benefit than the whole population. We did not look at the PD-L1 negative group, and that's something that we will do in the future. At the end of the day, we need the randomized clinical trial overall survival data, and we don't have that yet for this trial, and hopefully we will have that. We saw an interim one for adjuvant pembrolizumab, but that's not a final one. So what we really need is clinical trial data. Until that comes in, this may be as good as we have.